but you ask him about a particular play, he'll tell you everything about it.
All right, well, we are live, so I'm going to go ahead and I'm looking to see what time it is. I'm going to give us another minute, but we are. I hope everybody's had a restful night and you're eager to start this morning. We did know the mayor was not going to be able to make it in today. I think he was up. Well, he's got a busy schedule. So anyways, we'll miss him today, but I do know Katie Richardson and a few others are coming in. And Dan's coming on. Dan is going to be, oh, Anton's there. And the mayor is there. Anton, you're still muted.
Hey, now I am. I'm good now. Good morning, everyone.
Good morning.
Good morning. Happy Wednesday morning, November 4th to everyone. I want to make sure we try to keep everything on schedule and get started. So first, let me do a quick welcome and call to order of this meeting for November 4th, the November meeting. And what I'd like to do is to review the minutes from the previous meeting. So I hope everyone has been able to get access to their email and have the opportunity to review the meeting minutes from the October 7th meeting. And so what I'd like to do is give people about 45 seconds to review those. And then I'd be happy to entertain a motion to accept those and so we can approve them and move to the next part of the agenda. So.
And Anton, while everybody's doing that, I just want to thank all those who worked so diligently and hard throughout this whole campaign process of the election. I know the results are all over the place, but there's so many thanks for all those people working hard. And I know, Anton, you and the mayor were right there. So thank y'all for all you've been doing.
Yeah, well, I appreciate that. And we all, live in the greatest country in the world, no matter what we want to think about it or say about it at this point. And this is an opportunity for us to all contribute beyond just, participating as citizens. And so for everyone who volunteers and spends their time committed to the Health and Wellness Advisory Committee, I want to thank you too, because this is a part of citizenship, not just voting, but what you do after the election and in between the elections to make your communities and your cities and your states a better place. And so definitely shout out to everybody. So definitely a long process, but glad to see some finality to it.
So Anton, I'll make a motion to have the minutes approved.
Thank you so very much, Dan, for that motion. Is there a second?
A second.
Thank you for that second. All those in favor of accepting the minutes as presented, do so by saying aye and raise your right hand on camera.
Aye.
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 Okay. Those opposed, do likewise. Okay, great. The minutes have been accepted and approved. I thank you all for that. Now I'd like to move to item number 3 on the agenda and have Dr. Julie Lawrence give us a update or overview around overdoses and mental health during COVID-19 to just kind of know where things are right now.
Very good. I'm going to switch to sharing my screen.
Perfect.
Is that showing to you?
Yes, it is.
Great, great. Well, thank you for giving me some time. I'll try to make good use of your time this morning and tell you about some important new updates and then ways that maybe we can work together. Just to tell you a little bit about myself, I've been a pharmacist in the Charleston area for over 25 years. I work in the Roper St. Francis system. But about 5 years ago, I got involved with our, trying to serve as a pharmacy role in the opioid epidemic. So with Wake Up Carolina, And then with the EDGE Drug Prevention Alliance, I serve kind of in a pharmacy capacity, and my focus was trying to improve take back, to remove opioids from households and try to engage the public and educate people about how to make their families and their households safer. And then within Roper St. Francis, we started the opioid reduction team also about 5 years ago. And our focus there has been, from a healthcare point of view, how can we limit exposure in the first place so that we're not starting pain medications on people and using other methods instead. So today I want to start by kind of telling you where we are. This is the latest information. If you're familiar with justplainkillers.com, this is where DHEC posts the latest information related to opioids. So I took a screenshot here. We usually have about an 8 or 9 month lag. So the most recent information is from 2019, although I do have some 2020 information for you to share in just a moment. But when you look here at this map of South Carolina, we tend to have about 3 hotspots. So the Charleston area here, and then Berkeley, Horry County, this is Florence, middle of the state around Columbia and Richmond, York, and then up into the Greenville area. So Greenville, Horry, and Charleston. If you look over here, you'll see this is the Charleston trend. So in 2016, Horry County had the highest overdose death rates. And then in 2017, we took that mantle from them. It then went on to Greenville. And then for 2019, it's back to Horry County. So definitely some areas to be concerned about. And then closer to home, these are, so in our Tri-County area. So Berkeley, the first column is total drug overdoses. So between 2018 and 2019, 12.5% increase. I'm not sure if I can switch my screen around, but for the opioid overdoses, an increase in Berkeley County as well. Charleston, you can see an increase, and just like it correlates to that map I just showed you, we tend to just kind of tick up a little bit each year. We may not be the highest, but we're definitely in the top 3 typically. We've had some great success with Dorchester. Dorchester has gone down in both categories by a significant amount. So that's great news. So with COVID, this is kind of what I wanted to bring to your attention. We were concerned that we would see some negative effects of that, from the isolation, changes with job status, lots of stress and anxiety on folks, not being able to get to meetings, perhaps if people are in recovery. And so that has come to fruition. So this is, the governor started in April, the opioid emergency response team. And in, what month was this? I guess was in May was the latest. I think it came out in June though. They sent this emergency message out to hospitals, kind of warning them that these were the numbers that we were seeing. So you can see that this is between 2019 and 2020. And these were opioid overdoses. So that number in May, that 915, that is the highest that we've ever had in South Carolina state history. It's a shocking number. It's very alarming. I just got word yesterday from the director of DeOtis that I was asking her about some closer information, what's happened since May. And she said that trend has continued. So we have data through September, and compared to 2019, we're at 50% higher overdoses than we were in 2019. So lots of reasons to be concerned. And then this map over to the right is a heat map of where the overdoses are. So what stands out to me in this is, of course, we have those darker red, orange spots that correlate to that map that I showed you earlier. But the other thing to be concerned about are all the dots that are all in between. Those are largely rural areas. It's harder for folks in those areas to access some of our services. And so we definitely need to be reaching out to the rural areas as well, because there's concern there. So here's where we are with the opioids. The other big concerning, shocking information that came out from the CDC came out this summer. They did a survey asking people about their mental health status, during COVID, because we were concerned that it was having a negative effect. 11% of Americans considered suicide in the month of June. And this is twice the number from 2019. So double the rate from the year before. So really, really, concerning numbers. And then in the second bullet point, when you look at where did the highest risk come from? So 30% of unpaid caregivers for adults, and then 1 out of 4 of young people, 18 to 24-year-olds, actively considered suicide in the month of June. I know from our own area of working with the coroner that we're seeing these, unfortunately, in our own area, in our own neighborhood. So we need to do something about it. The rates of depression and anxiety have quadrupled and tripled. You probably know that from people that maybe in your family, in your friend groups, people that you work with. I know I hear it from, I have 3 young adult children, and they tell me stories about lots of their friends. They're really struggling with not knowing what's going to happen, and with changes to their situations with school, with their jobs. And it's very, very stressful. So lots of need for mental health help, and lots of need for people who are in recovery and need help with recovery. So one of my concerns, all these 5 years I've been working in the space is how to connect people with help. I'm sure you all look at the Charleston Needs Assessment Survey. So I looked at that from 2019. That's the latest information that we have out. I don't think that they sent it out for 2020 because of the pandemic. But even last year, when they asked, survey, I think it was about 5,000 people in our Tri-County area, most people did not know where to go to get help for either substance use disorder or for mental health. And the options ran the gamut from, I'm going to go to the ER, I'm going to go talk to my doctor, I'm going to go to my church, I'm going to talk to a friend. People just, guessed. They really didn't know where to go. So I was really happy to find out in September that in our own state, we've had great success with these departments. DAODAS and the South Carolina Department of Mental Health have received some federal funding, and they've put together this hotline. So it's a 1-844 South Carolina HOPES. That is a one-stop shop where you can send people for these problems. So if it's mental health support, if it's access, for addiction, needing treatment centers or somebody locally. And then they also have a third kind of byline that's for healthcare workers that are struggling during COVID with either one of those two, which is a nice little niche. Because of course, all of our healthcare workers that are in the trenches are really having a hard time with what they're seeing, what they're coping with. So I've talked with the director of this program and kind of gotten some details about how it works. It sounds like a fantastic resource. It's a place where the person who's answering these phone calls has been trained, knows how to direct the caller to resources and programs that are in your own area. So they're going to ask you where you're calling from, and then be able to tailor that answer to a place that's local to you for either of these two problems. So that's great news. So I have an ask, and it's coming. Hold on. So one of the first things is to tell you what we've done with River St. Francis. So with my community involvement with the prevention organizations, we've been able to place some take back boxes, both in law enforcement and at retail pharmacies. But this past year, we did get a grant through Trident United Way, holler out to them, which has really helped us go out into the community. And we're especially trying to get into those rural areas where they don't have access to safe disposal of prescription, especially opioid drugs. So last year, we were able to collect over 700 pounds. And if you can see that in person, it is just bags and bags and bags of medications. This year, we're up to over 400 pounds. Obviously, we've been hampered by the situation with pandemic. So for months and months, we weren't able to get out there. But we came up with the idea of doing a drive-by drop-off. So we've had great success with people just pulling up in their cars, and we take what they have. I've had great success working with local law enforcement, really, really good partners. Shout out to the departments of the police departments in Charleston, North Charleston, Mount Pleasant, and the Berkeley and Charleston County Sheriff's Office all of them have been really, really helpful. So we have some new events that are coming up. You'll see that, again, just to reiterate, that we're trying to get into rural areas. So we're going out to Hollywood tomorrow, yeah, Thursday. And then we're reaching out to the Hispanic community on the 12th, going to the New Covenant Church. And then on Friday out to the Senior Center on James Island. So 2 things to tell you about. Number 1 is I sent Paul a document that I try to keep up to date that has a list of all the permanent take back boxes all over the Tri-County. So if you are interested in having that, I ask you to spread it as much as you can so that people know where they can find a box that's local to them. But also to ask you if you would want to partner with us to hold one of these take back events. We can hold them anywhere, at a business, in a lobby, public parks, anywhere, as long as we have our law enforcement partners with us. And they've been great, and they've turned out every time that I've asked them, to come out. So if you have ideas of an area that has a need, we'd love to partner with you on that. So please let me know. And the last thing is about the South Carolina Hopes. I told you I'd spoken with the director for that program. He's trying his best to get the word out about this. He has it on some billboards. I've seen some TV commercials with it. He's trying to get out in social media, but I really just haven't seen it everywhere. And it's such a great resource for our community. I think it's something that we need to do for ourselves. We're going to have to step up, each of us, whether it's a business or a public entity, and try to do your share and do what you can to let your employees know about it. We've spread it within River St. Francis to all of our teammates. I sent it to law enforcement to post on their social media websites, but it'd be great if we could get it out to students and parents. And then the last thing would be if there's a way that we could bundle our resources, maybe each of us, couldn't do a large thing or afford to do a large thing on our own. But if we bundled our resources and were creative, maybe we could do big things together. So I will take any questions or comments that you all might have.
Wow, you that was there was a lot, and heavy, but and also difficult to hear some of the challenges that people are having. So what I want to do is make sure that we open it up from questions. So I have a couple comments in the chat that I want to read because I know people on YouTube may not be able to see that. DMH also has a statewide mobile crisis phone number where clinicians are ready to help 24/7, 365. That number is 833-DMH-CCRI. If you could give me the numbers, the actual numbers for that, so we can make sure people know what those numbers are. And then Joey has a question, which is, do you have overdose data disaggregated by race and ethnicity? If not, do you have a sense of what that would look like, particularly how racially diverse communities are impacted by some of these statistics that you share with us?
Yeah, let me see what I can find real quick. I had this website open. It's going to refresh here real quick. I believe it is on this site. I'm not sure if I can access it quick enough to give you an answer, but I do have it by gender and age. They show this here, if you can see that. Mm-hmm. So yeah, female, male, across the board. Just like we always talk about, it's everybody. There really isn't anybody who's not at risk. Mm-hmm. And also, I wanted to tell you too that the overdoses. I was curious to see how they were going to split, because we have had, I think in healthcare, the idea that we've got the prescription opioids under control, mm-hmm. and that's not a problem. And that now it's the illicit drugs, it's heroin, methamphetamine, cocaine. But the data that I got from Deotis, with the 50% higher than last year, it actually is split. It still continues to be prescription drugs and illicit drugs both. But if you want some more detailed data, I know we're kind of short for time, I would send you to the justplainkillers.com website. You'll be able to find all of that detailed data in there.
Okay, great. Thank you. Any other questions on this presentation? I know we all are taking it all in at the same time. Are there other ideas or other things that we could be doing at home? So like when we see things manifesting in our families or people that we have close relationships with, I know, it's great to have a hotline, a number to call 24/7, but is there any thought process for people in their communities to be able to try to support people in this way, particularly around the mental health piece? The opioid piece, of course, you definitely have to seek medical help and medical assistance, but is there anything that you would recommend that we do individually?
Yeah, absolutely. I think the best advice I would give is when you see somebody struggling, to say something. As with so many things, that personal connection just makes all the difference, to actually connect with somebody and for somebody to recognize and see that pain and struggle that somebody else is going through, often is the first step to finding help. So if you see something, in somebody that do pull them aside and say, hey, it looks like you're having a rough day. Do you want to talk about it? And sometimes just making that first step just opens the door.
Very good. And again, Jennifer, thank you so very much for putting this into the chat, that the Department of Mental Health's statewide mobile crisis number is 833-364-2274. Or in Charleston, Dorchester counties, you can call 843-414-2350. And that's the Charleston Assessment Mobile Crisis Line. They also take walk-ins Monday through Friday from 9 a.m. to 3 p.m. in both Charleston and in Somerville. So thank you so very much for that. If you could just stop sharing your screen, Julie.
Okay.
That'll help us.
Thank you so much.
Anton, I had a quick question for
Yes,
Julie.
please do. Go ahead.
If possible. Just a real quickly, Julie, thank you so much for your information. I was wondering, how is your information about the permanent take back boxes shared with the public? How do people know where those are available and how are they secured?
Great. So let me answer your second part first. So how they're secured. DEA has very stringent rules about where they can be placed to begin with. So they only allow them to be with law enforcement. So obviously those sites are secured. And then they allow them to be in pharmacies with very stringent rules. They're bolted to the floor or the wall. They have to be in close proximity to the pharmacy. They have to be in a place that has a lot of public view. So, and then it's like a mailbox. It's a one-way opening. So, and the rest of it's locked. So really you can't get access to it. Now I forgot what your question was.
Oh, how does the public find out about it?
Oh yeah, with the permanent. So we have a opioid tab on Represent Francis, on our website. So we have it placed there. I've given it to law enforcement to post on their websites. Every time we have a take back event, we hand them out to the public. So any places that you all would want to post it would be fantastic as well. And I've sent that to Paul, so he has access to that.
Very good. Any other questions, comments on this agenda?
I have one.
Yes,
Anton.
please go ahead.
And I'd just like to thank you, Julie, for doing a beautiful job of, as one of our partners, talking about that program. I just did want to add that another option for education is our center and most of the centers across the state teach mental health first aid to the community at no charge. And then we have an adult class where we're talking about how to recognize signs and symptoms of mental illness in adults. And then we also have one for children and teenagers. So if you reach out to us, we'd be happy to do. We're doing Zoom classes at this point, but it just helps you, like Julie was saying, know what to recognize, and then what to do if you do experience somebody that needs some help. We also have a suicide prevention office at our state office that we're happy to go to schools or churches or anywhere and educate people about what to do for suicide prevention. And of course, we're open for walk-ins here in Charleston and Somerville. But if it's an emergency, I mean, you can walk in anytime we're open. We're not going to say, no, it's 3:30. So just want to make sure you're aware of that. And yeah, both of those numbers for mobile crisis are available. And actually our center is now taking all the mobile crisis calls for the state. So please reach out to us, even if you don't know if it's serious or not. We'll help you walk you through it. Again, Julie, thank you so much for bringing that up. And we have been doing some advertising and things, but as you said, as much as we all talk to each other and try to share the information, there's still plenty of folks out there that don't know where to go. So thank you for that.
Yeah, Julie, I'm gonna come back to you because you were actually on the agenda next. Mayor, you had your hand up. I know you had a question or comment.
Yeah, I wanted to thank Julie for the presentation, and I know that you and Jennifer worked with our police and fire departments already, but given the information you shared about the increase this year with 2020, which doesn't surprise me with COVID-19 going on, but I haven't seen the statistics yet. I'd like to just reconnect and make sure we have the latest, greatest partnership and information going out. They contact more people, but also then, and Carolyn, I know can help on this too. We'll do some social media with you to spread the word as well before the end of the year. So thank you so much.
Thank you. Wonderful.
Yeah, so I didn't mean Julie was the next on the agenda. I meant Jennifer is next on the agenda. And so Jennifer, I know you just gave a few remarks. Do you have anything else you'd like to add to help us to know about from a DMH standpoint, what we can be doing, what you guys are doing, or anything that would be important for us to make sure that the residents and the citizens of the city of Charleston need to know?
Well, the other thing that we are doing is we're trying to reach out to more faith-based groups. And so we've been doing, it's not really a mental health first aid class because those are 8 hours long, but we're happy to do any length of time you're willing to listen to us to talk about where to go, what to do, what to recognize. But we are trying to reach out to everybody. So if anybody has any interest in hearing what we do and our programs available for people, please let me know. And other than that, we're here for you 365 days a year. So please call us.
Thank you very much. Really appreciate your work and your help and your leadership. Okay, so we're now on agenda item 5, which is really kind of a COVID update, local health update. So Dr. Richardson, I know you're on. I don't know if you have slides or a presentation or just a verbal update. I'd love to have that.
And Tracy.
And Tracy.
Yep. I don't have slides. Tracy, you want to do the data first and then I'll talk about a few updates?
Yeah, that'd be great.
Sure. Yeah, thank you, Mr. Chairman. I'll share my screen here. This should be very brief. So this is looking at cases, the daily new cases at the Charleston City zip code level. And the dark blue line then kind of shows that rolling 7-day average. So you can see, we've been on kind of a very, very slight increase in cases at the zip code level. So we seem to be faring pretty well right now. I think it's going to be very interesting to see what happens over the next couple of weeks. But at this moment, we seem to still be doing well, even though we are seeing, a slight trend upwards in cases, which we don't want to see at all, right? We'd like to see it keep going down. But just to give you an idea of how big a difference we're seeing, this kind of looks at the past 4 weeks. On the week starting, the total new cases from testing, and then kind of what that weekly change has been. So you can see from October 5th to 12th, we saw, a fairly good increase in new cases, slight decrease. And then last week we saw another uptick in cases. Obviously we're not trending in a good way, but it's not the surge that some places are seeing. I guess another important thing to talk about just briefly, just for an update, employee cases. I know obviously Paula is on the call as well as Jan, and Jan with our safety team, their work and helping to ensure that, we limit exposure at the workplace has been really, really critical. And right now we have 3 active cases and 9 others waiting for test results. And that's been very, very low, I would say, since July. So we've managed to keep employee cases really down. At least, we can't control what people do outside of work, but everyone's doing a really great job at work. So last week when I checked in with MUSC, I wanted to check in on hospitalizations. MUSC reported still, really low census count for COVID patients. They did mention that Roper had seen a slight uptick in COVID cases. So I'd really like to if someone has some recent numbers from this week on Roper, I'd like to hear from them to understand if they're still seeing that, or if that was maybe just a little blip that they saw. But another conversation that we had was around weather and looking around the country at what's happening and really around the world. And so we looked at this map of the US and cases along with weather. And I don't think you have to really do a deep analysis to really see how well the patterns of cold weather are aligning with the number of cases across the US. So that's definitely something to kind of keep our eyes on, especially over the next few weeks as we kind of watch our case numbers at the local level. So this is a little concerning, I think, but so far right now we're not trending in a great way, but we're not seeing a surge in cases either. And that's all I really have for today. So I'd be happy to learn more from Dr. Richardson and happy to take any questions that anyone has as well.
Any questions from Tracy's presentation out the gate, or let's just kind of wait and let Dr. Richardson give us some framework.
Thanks, Anton, and thank you, Tracy. You always do a great job of presenting really on the zip code level for Charleston. And I haven't heard from you. Do you have the zip code level data again for the dashboard?
The short answer is yes. It's followed by a big but we'll hold off on the but.
Okay. I was hoping it was good news since I hadn't heard from you, but so just a little explanation for that. DHEC realized that not all safeguards were being followed from a privacy perspective on our release of zip code level data across the state. So we had to pull that back short term. Trying though to get it back out to our municipal partners and others to ensure that those dashboards can be populated for sort of evidence-based decision making around COVID. And Tracy's certainly been on the forefront of that from the beginning, and we appreciate your advocacy of that. So what Tracy says is true for Charleston is also true in South Carolina generally. Now, the CDC says that all 50 states are actually moving in the wrong direction. It was like 37 states, and we were not one of them, and there was 43, and we were one of those. And the most recent data that's been sent to state health departments says that all 50 states are now in a downward trend or upward trend of worsening cases. And so, but it is true that South Carolina is more slowly increasing than some people or some states. So that's, we definitely are tracking it closely where, one of the things I wanted to talk about when we were talking about sort of demographics is looking at school-age children. Mm-hmm. And we are happy to see that has really plateaued. And this is for low country region generally. So we see little blips here and there, but generally it has been stable now for some time in all age groups, really 0 to 18. So preschool and school age children. We do know that Charleston County school districts and others across the state are increasing the number of in-person students coming back. Charleston County, that happens November 11th, so next week. So we will continue to watch that closely. But the school district, I think, has been doing a wonderful job with contact tracing, close contact with them, and they are, despite a lot of pushback, continuing to institute all the recommendations that we in the CDC are giving them as far as quarantine, even sometimes for large numbers of contacts to a case. So other than that, I don't, I just want to talk briefly about the 3 W's and ask you to please continue to get the message out. I know people are getting tired of the same messages, so we continue to try to say it in a slightly different way. But the 3 W's are wear a mask, wash your hands, and watch your distance. And so that's a slightly different spin to the same message. And if you can use that, which with your constituencies, please do so. That will become increasingly important as it gets more cold and as the holidays come around and we all make decisions about seeing those that we love and have missed, but also trying to protect their health and the health of our communities generally. We continue to recommend testing, and we have had a 16% increase in testing in October compared to September. And so that's certainly in a positive direction, and we hope that that will continue to increase. We hope to have testing at College of Charleston next week for 2 days outside the I think it's the Stern Center, but maybe the library. But anyway, it should be coming out soon about that. So we're trying to increase access to testing on the peninsula as well as across the region. So we continue to recommend people go to the DHEC website and to find testing locations. I think it's really clear which ones are free, which ones are walk up or drive through. We are not doing the MP swabs, so those are sort of deep nasal swabs anymore. We're doing more anterior nasal swabs at this point, and it's all PCR testing. And generally the results are coming back in around 48 hours. So we've really cut down the lag time. And then MUSC and Roper and Fetter and many of our other partners also continue to provide frequent testing in the community. What else did I want to say about that? I think that's sort of the general update for COVID. So do we want to take a break, Paul and Anton, and take questions on COVID? And then I have a few other DHEC updates.
Yeah, let's do that, because I actually have a couple of COVID questions that I want to give people a chance to. Paul, you had a thought you wanted to say? You're on mute, Paul.
I just wanted to remind Katie to talk to us about CDC DHEC understanding of social distancing and the cumulative.
Thank you. Thank you. Sorry, I'm a little discombobulated today. I think I stayed up too late last night and I shouldn't. We don't have many answers.
You should have went to bed.
Right. So there has been a slight change in how we calculate the time period for a close contact. And this is something that DHEC actually was saying even before the CDC sort of came out officially, but we are now, and it's based on an MMWR report from, I think from the 30th of October, but it now does not need to be a 15-minute period in one time stretch. We now would like the time period to be calculated as a cumulative 15 minutes over a 24-hour period. And that really comes from a study at a correctional facility where an employee had multiple brief exposures to inmates with COVID-19 in Vermont. And he, I think it was a well-done study that was able to say that this is likely where he contracted COVID-19. And so that, along with some other evidence, but that's really sort of what finally had the CDC to come out with this official change. And so even if it's, a flag football team where it's, 1 or 2 or 3 minute time periods, but over hour and a half period of playing sports together, those children were within 6 feet of each other. Then we do believe that those kids in that example should be considered close contacts and asked to quarantine for the 14 days. So thank you, Paul, for reminding me to discuss that.
I also have a question about testing. I was going to ask you about how rampant or robust testing is now. And my wife is a coach in the high school level, and she told me that she received a notice that saliva testing is available for student athletes who are preparing for the spring season. So can you talk a little bit about what we should know about the, PCR testing versus, saliva testing and the effectiveness of it? Do you recommend that people do one or the other?
That's a great question, and that's an area that certainly has been rapidly evolving. So, Charleston County, I can speak about Charleston County School District first, if that's where your wife coaches. Yes. So MUSC has graciously offered, and it's about to roll out, if it didn't roll out yesterday, very soon, we'll be providing saliva testing supplies to the school district, so to all schools, along with guidelines on their use. And they will recommend, I believe, that the saliva-based testing be used for symptomatic students and staff. Those will then be couriered to MUSC and will be run, and hopefully the result will be back in 1 to 2 days. That is a PCR-based test. The sensitivity is slightly less than the nasal swab, but it's sort of low 90s versus mid 90s. So for the vast majority of cases, we will trust the result from that saliva test. There may be a very few cases where our sort of pre-test probability is extremely high that we may recommend doing the virtual care through MUSC and then going in to get a nasal swab in the drive-through testing that they offer. But by and large, the saliva-based testing results will hold true. So that is a wonderful service that MUSC through Back to Business and their testing group is putting in place. And I believe they do hope to sort of expand that once Charleston County begins and sort of gets into a rhythm. They have other schools that are their Back to Business clients. And then I think they hope to, further expand it as they have ability to do so. Now, in addition to that, DHEC is very close to rolling out Binax Now testing kits to schools across the state. Now, that is a rapid antigen test. Looks like a credit card, is done on a nasal swab. And sort of the final pieces are coming into place for CLIA waivers, so sort of lab waivers, since the test will actually be done at the school. And how Charleston County will incorporate these, which are not as sensitive as the PCR testing, but do offer sort of a rapid result. How they will incorporate the Binax Now, they know. I certainly don't know how they will use that, but most other school districts that will not have access to the saliva testing initially will be able to use these cards on symptomatic students and staff, with parent permission, prior to them being sort of picked up and going home, if they are symptomatic. And then because it has a lower sensitivity, those tests that are negative, but again, the child is symptomatic and may not sort of improve quickly, often the recommendation will be that they follow that up with a PCR test. And so that's what I know about sort of school-based testing. The final part I want to say about saliva-based testing is that DHEC is also starting to roll this out slowly to the general public. So we may still have some saliva testing kits available they were initially distributed to all of our health departments. So you could go into any DHEC health department, pick up to 5 tests, with giving names for those tests, but they don't have to be the same people that return them. They can be used anytime between when you pick them up in June. They're mailed in via FedEx, and results are delivered. And so we certainly, this is really a supply issue of getting enough saliva kits. We know that that this is preferable to some, although I've also heard the opposite, that some people who've tried the saliva really now prefer to go back to the nasal swab. So we just want to increase sort of the options to encourage testing, and more to come on the increased availability of that for the general public in the coming weeks.
I find it funny that people want to go back to the nasal swab for a test. I guess people like getting their brain scratched more than they do like dropping saliva.
Some people just say it's hard to produce that much saliva.
Oh, yeah, maybe that's it too. That's it too.
Yeah.
Okay. Any other questions for Dr. Richardson on all of this?
Anton, I had a quick question.
Yes.
Katie, you mentioned the fact that in school-age children right now in South Carolina, we seem to be doing pretty well. And Tracy obviously produced that lovely map that showed that in the colder climate areas, there's a pretty dramatic increase. And I guess my question was, do we have any examples? I guess first part of the question is, as we've seen cases rise in those colder climate areas, have we seen school-age children be a part of that population that's seeing an increase in their cases? And are there any examples of maybe these colder climate areas where maybe there isn't as much of a spike in school-age children that might offer some advice or recommendations to us as we head into our colder months in order for us to try to keep down our case rate among school-age children?
That's a great question, and I've not seen good data published on that. Part of it is that states are still so diverse between how many kids are back at school and how that looks across different areas. So I don't know. I guess what I'll say is I've not seen evidence that there are spikes in school-aged clusters, for instance, anywhere in the country. I shouldn't say anywhere. I don't know everywhere, but I've not heard of examples that have gotten much press about large spikes in school-age children being contributing to the increases. But we'll certainly be watching that closely in South Carolina, both as more children do go back to school in the coming weeks, and then as schools move into winter sports, many of which are indoors and close contact, basketball and wrestling are two that that come to mind. That I think schools are being very deliberate in trying to put protocols in place to decrease the risk, but I will be interested to see how that affects our school-age children's rates, and then obviously travel and holidays and what families choose to do with that time, I think will affect it as well.
Very good.
Katie, I have a question, just a follow-up on what you just said. As we're coming into the holidays, and we also have a lot of the college students that will be coming back after being wherever, and wanting to gather with families, what is the recommendation around quarantining and or using testing as a way to then make some decisions about family gatherings, or even just bringing those folks back into the home?
I mean, I think either are good recommendations. I prefer the testing route. Again, I think the access is really there now. I don't know that there's like a specific sort of amount of time, but I think doing testing near the end of their time at college, and then, shortly after they get home, and potentially quarantining for that time before the result returns, certainly would make sense. I have heard a number of families and think it's a great idea that, and we're not recommending any sort of larger gatherings, but if there are families who are hoping to gather over the holidays, that, having all the family members tested prior to that so that they can test and get their result back certainly offers some reassurances, although the person can certainly become infected the day after they test, but some reassurances. We had another recent study in MMWR with a child who over a summer break was tested, did test negative, proceeded to go and be with a large family gathering in a house together. And a majority of those family members did get infected from that event. So I think testing, and our preference is for PCR testing, but if antigen testing is what is available, any testing is better than none.
Thank you.
Dr. Richardson, I have a quick question based on a recommendation from DHEC, which I've seen saying for those folks who are out and about in the community, the recommendation is to get tested monthly. Just so for folks' clarification, can you remind us what that means, out and about, so that we know who needs to, on a monthly basis, go and get tested?
I really interpret that to be pretty much everyone. I mean, if your grandmother is really staying at home and someone's bringing their groceries in and they're, not staying for 15 minutes, and so they really have very little contact with those outside of their home, then they may not qualify. But pretty much anyone who is leaving their home for work, for school, for shopping, are those that are out and about. And that's even those who are practicing the 3 W's that we talked about: wearing a mask, washing your hands, trying to keep your distance. That's the group that we recommend once a month. If you're unable or unwilling to do those 3 W's, then we recommend more frequently than once a month. And there's no limit to how many DHEC, if you go to a DHEC site for testing, there is no criteria that you have to wait at a certain amount of time from your last test to be able to be retested. So that is a message that that we're working hard to get out. And I appreciate you asking that, Joey, and would be grateful, for any help in getting that message out, that everyone, even without symptoms, should be tested at least once a month. That's without symptoms and not being a close contact. So for sure, if you have symptoms, we recommend testing immediately. And if you've been named as a close contact, we recommend testing, if asymptomatic, on day 7 after that contact, and if symptomatic, at any time during that time after being told.
I know we got a couple more agenda items, and I see some questions in the chat. So I'm going to ask Dr. Richardson to look at what's in the chat, particularly from Dan Bornstein. And what I would like to do is go to the next agenda item, which is a health and all policies update. If there's a brief update, because I really do want to allow a little bit of time for the community update at the end. So, and health and all policies update. Paul, I'm going to flip it to you.
I'm going to flip it to Susan.
Yes.
Can I share my screen, Paul?
Yes.
Okay. Can y'all see the slide?
Yes.
Okay, great. So last Tuesday, we provided a brief update to City Council and on the health and all policies, and then requested an approval of our motion. So just as a reminder, our motion that we crafted at our last meeting, I believe it was October 7th, was that City Council approve our health and all policies approach, specifically around the 2020 Charleston City Plan. And that was approved and supported. Councilman Shealy and Councilman Seekings both spoke on behalf of our committee and our work. So I think it was really well received. And as far as the next steps, I think that any and all of these are on the table, but I think certainly first step would be, as we talked about in our last meeting, to form a subcommittee to establish kind of a path forward. So what does that framework look like, and how do we participate in that city planning process using the health and all policies approach? And then certainly would also like to consider further down the road, considering a resolution of some sort to really implement this, not just in the city plan, but in all of the different areas of the city governance. So I can answer any questions. Paul, I don't know how you wanted to move forward with the subcommittee assignment, or Anton.
Anton, my question, well, my input is that we've had several people that have experience in All In for Health that wanted to be a part of that subcommittee, and Katie Richardson did her college work or her extra degree work on health and all policies. Joey has been very instrumental in helping us with it, and Meredith Berlinski from Roper St. Francis wanted to be a part of it. So anybody else, but those four at least wanted to and Susan, of course, but those four wanted to be engaged in this, and I'll be the staff person with it as well.
I was going to recommend we just go with that group, since they're vested and interested, and we can give them the opportunity to move in. Oh, okay. Yes.
Hey, it's Lori Yarber, in Recreation.
Go ahead, Lori.
We're working on our Parks and Rec master plan, and I definitely want to make sure that as this starts coming around, that this equity piece and model is picked up in that. I'm very concerned with where we're seeing gaps right now, and I think COVID has put us in some more gap areas. So I just want to make sure that stays in. Our consultant is doing some work with us, so I want to plug into that, okay?
Very good. Thank you very much. I appreciate that. Mayor, you got your hand up. Go ahead.
Yeah, I just wanted to thank Susan for her presentation to council last week. Unanimously, we're very excited to incorporate health and wellness into everything we think about. So it went well. Thank you, Susan.
Very good. Very, very good. Okay, so let's jump to the community update, and I'm going to try to cover some of the things I see in the chat, just so I know we have people on YouTube who may not be able to see the chat. So I want to make sure I relay those comments. So let me go to the community update, and let me turn it over to, who was that wanted to make a comment? Paul, I think you told me.
Lisa Burbidge.
Lisa, yes, Lisa, please go ahead, Lisa.
Thank you, Anton. Hey, everybody. Since I'm a newer member of the committee, you may not know what I really do, but I do employee wellness. I'm a wellness coach primarily in the private sector. But occasionally DHEC, Katie, will call me and ask me to run programs for them if they've got grant money, which they do right now from the CDC. It's a grant to get the National Diabetes Prevention Program out in the community. This is a wonderful opportunity because this program is usually not free, not to this extent. These programs are going to be virtual. And as long as somebody's a South Carolina resident, they can participate. If anybody knows about the National Diabetes Prevention Program, it is a CDC program. It's not a diet program. It's not an exercise program. It's a program to empower people to take control of their health. And no better time to do it than right now. So thanks to Jan, the class I'm starting today is almost full with city employees. I'm excited to share, and a contact over at the county has done a great job getting the word out. But I wanted to just mention it to all of y'all. If you know anybody, Katie, correct me if I'm wrong, but I think this grant is available right now because we all know that diabetes and cardiovascular disease it's a comorbidity for COVID. So the timing could not be better. So if y'all know anybody, have them reach out to me. Paul, you can probably share my email with anybody who needs it, or I can just put it in the chat real quickly. I'll just do that. But thank you, Anton, for giving me a few minutes to tell everybody about this free money. This program is virtual and it's free. Doesn't get much better.
Very good. Let's get a quick flu update from Katie, so to give us an update about the flu.
Yep, thank you, Anton. Sorry, I seem to have a lot of information these days, but we unfortunately we're not doing our school located flu vaccine clinics this year to try to keep visitors out of schools, but we are doing community flu clinics. And Paul already shared the schedule for last week and this week. With this group. I will continue sharing those with him, but they are generally walk-ins or even drive-throughs. They're completely free. We are advertising them with the lead school nurses. So they're really, to replace our school located vaccine clinics, but they are open to anyone who comes. So children as well as adults are welcome to attend these clinics and get a free flu vaccine. Fortunately, we are not seeing any significant flu activity yet in South Carolina, but we continue to believe that this year is one of the most important years of our lives to get a flu vaccine. And so very much so, we are asking for everyone to prioritize this and to continue to attend. But generally, our Northwoods Clinic, our Somerville Clinic, at our Colleton Health Department, and they'll also be around the Low Country region. So I will continue to share those with Paul, and thank you so much, Paul, for continuing to share those with this group.
Definitely, thank you for that update. And you reminded me I got to go get my flu vaccine today, so I'm going to get it. So anybody have any other thoughts or comments that they'd like to add before we bring the meeting to a close?
Anton, I did want to give one last update, and that's on our Fast Track Cities initiative. That's for ending the HIV epidemic. We do have a sort of initial grant proposal out through the Patient-Centered Outcomes Research Institute to form sort of a community consortium, bringing together those living with HIV as well as those at risk or those who support family or friends living with HIV. We want to be able to pay these participants for their time and expertise. And so we hope to hear within the next month if we are asked to put in a sort of full proposal for this, but it was very much is a partnership, continues to be a partnership that really grew out of our work in this committee. And I'm very thankful for all participants, and we'll continue to keep everyone in the loop as this develops. Thank you.
Very good. Mayor, please go ahead.
Mr. Chairman, while other folks are thinking about who's going to be the next president of the United States, I'm thankful that we're thinking about the health and wellness of our everyday citizens and what we can do to make a difference here locally. So I just want to thank you all. We're going to continue this work, and what a great team we have here. Thank you.
Great. Well, thank you very much. Dan, I know you got to jump, and a few other people have to jump as well. I want to say that we will also plan to try to put together a special meeting to talk about health disparities and health equity. That's been a charge that we've been asked to contribute to and participate in. And I don't think our regular meeting schedule will allow us the time to be able to dive into this the way that we need to. So we want to try to put together some special meeting to talk about this. And so you'll hear more about that in the coming weeks to respond to that. So with that, I'll be happy to entertain a motion to adjourn.
So moved.
Is there a second?
A second.
A second.
Okay, great. It's been moved and second that we adjourn the Health and Wellness Advisory Committee meeting for November. All in favor, say aye.
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 Those opposed, do the same.
Thank you, Mr. Chairman.
Y'all have a great day.
Thank you, everybody.
Thank you.
Bye-bye.
Bye.